Okay, so we just finished to clarify each cranial bone. So today I will introduce how they join together. So that's the joint of the skull. So one by one. So first of all, we quickly review of each cranial bone. Okay, good. So everyone knows that we have the cranial bone and the facial cranial. So it forms our cranial cavity. We will find the white one that's located on the anterior superior. So that's we call the front bone. And the superior right left, that's we call the parietal bone. So they join together form that's we call the coronal suture. Coronal suture, that's we call the fibrous joint. Two parietal bones joined together, so that's we call the sagittal suture. And on the posterior side, so we will find two parietal bone and one occipital bone. So they form that's we call the rhomboid suture. Look at the lateral side, so we will find a very interesting point. See? The white front bone, the green parietal bone, the yellow temporal bone, and the gray, which bone? Can you figure out? Yes, phenol bone. So they form the H-shaped point. That's we call the pterion. The pterion is the skull weakness, and inside, so we have the middle meningeal artery. So if broken here, the artery would be broken and bleeding inside. So that's we call the epidural hemorrhage. It's very dangerous for your life. So when we are on the emergency situation, so we need protection our pterion. So look like this. Okay. I will show you the only synovial joint in our skull. So that's we call TMJ. So it's the temporomandibular joint. So temporomandibular joint, so they form the temporal, okay, so it's the temporal bone. So temporal bone, two structures so form the joint. Number one, that's we call the mandibular fossa. Anterior part, that's we call the articular tubercle. So limit our mandibular dislocation anterior side. Okay, so it's very important. So 2 point and another one, so that's we call the ramus of the mandible. So this we call the head of the mandible. So formed the temporomandibular joint. Actually inside we will find, inside we have the articular disc. So articular disc divide the capsule superior portion and inferior portion. So it's very important for strong this joint. So it's difficult to dislocation. So we will find the capsule, so we will touch it here. The capsule is thin and relaxed. The lateral side is very strong. So the mandible easy dislocation. Anterior side, see, look like this. So all the men, when they laugh, we always tell them, do not laugh aloud. Why? Because the older people, so the muscle and the ligament is losing, so easy dislocation. So how to put it back? Because we had the articular tubercle, so we put it back, we need descending and backward. So we will upward, okay, descending and backward. So look like this, okay. So it's a very strong muscle, anyone knows. Which muscle? Chewing, yes, the chewing the gum look like that, okay. So that's what we call the masticatory muscle. Okay, so we just clarify the movement. Do you know the movement? Say, yes, that's what we call the depress and elevator. So what's this? So that's what we call the protractor and the retractor. Then we still have, yes, rotate, okay, rotation. That's what we call the rotation. So that's what the movement of the temporomandibular joint. So anything else? Yes. So see, we all look like it's the suture. So it's a joint together, it's very tightened. So how about the fetus? So the baby, when the baby born, so we will immediately find the front, we have the soft spot. And posterior side, we have the soft spot. So what's this? Because the baby, after they born, so this scar is developed not well. Why? Because they joined together, it's not closed, so they limited here. So that's what we call the anterior frontoneer and the posterior frontoneer. So that's keep our brain continued development. So the question is, if the baby burn, so the frontoneer, for example, soft spot is closed only, so what would happen? So it must be the brain glow up. They didn't glow up anymore. Okay, so would be influence their IQ.